Okay, hello everyone, and thank you for joining us for our webinar, Facts About COVID-19 Vaccines. ADAPT is excited about the release of these vaccines and are also aware that there is some confusion and concern around the safety and effectiveness of them. In this webinar, we will share some information we have regarding the vaccines, as well as answer as many questions as possible in the time allotted. We have received many questions ahead of time. Thank you so much for everyone who's already submitted. If you would like to ask a question, please do so in the chat box feature at the bottom of your screen. We will attempt to answer as many questions as possible. And you'll be able to send any questions to info@adaptcommunitynetwork.org if we don't get to your question today. I'm pleased to announce our panelists for today's webinar. We have Dr. John Michnovicz, our medical director. John has been with ADAPT for over 30 years and works with 6 different agencies across the city and supports individuals with intellectual and developmental disabilities. He has a deep understanding and extensive experience with all aspects of the disability world, including day programs, residential settings, hospital-based, as well as Article 28 outpatient clinics, and specialty clinics and research. In addition to being a medical doctor, he also holds a PhD and has performed medical research in nutrition and breast cancer prevention and has published over 45 peer-reviewed journal articles and book chapters. We also have Rose Wargo, our Vice President of Nursing. Rose has been with ADAPT for 15 years and oversees all of our nurses and has been working around the clock to ensure the people we support and staff are safe throughout the pandemic. She has implemented new practices and safety measures and has been carried out by each program and ensured we had enough PPE across the agency. In addition, she has provided training for staff and people supported to reinforce important information around using gloves, masks, and protective equipment effectively, while also receiving general universal precautions and infection control guidelines. Rose is also certified with the Developmental Disability Nurses Association. Sharon Lipscomb is our nurse practitioner at ADAPT, and she has been with ADAPT for over 7 years. And she oversees our residential sites in Staten Island. She also works in our Brooklyn clinic as a primary care and women's health practitioner. She has been a board-certified family nurse practitioner for over 14 years. She has provided care at several major medical centers, a substance abuse treatment center, as well as a private neurology practice. And it's my honor to introduce Ed Matthews, Chief Executive Officer of ADAPT Community Network. Mr. Matthews has been our CEO since 1989. He began his professional career as a school psychologist in the New York City Department of Education. During his tenure with the New York Office of Mental Retardation and Developmental Disabilities, he directed the team responsible for the acquisition of all residential and day program sites to implement the deinstitutionalization of Willowbrook, Staten Island, Letchworth, and Westchester developmental centers. In February 2011, Governor Andrew Cuomo appointed Mr. Matthews along with a select group of individual leaders to be a member of our medical redesign team, a special task force responsible for the overhaul of New York State's massive Medicaid system. He also appointed to be a member of the OPWDD Provider Association and the OPWDD Work Group, tasked with modernizing the fiscal financial platform. Mr. Matthews holds undergraduate and graduate degrees in psychology from Fordham University and St. John's University, respectively. Please join me in welcoming Ed to tonight's webinar.
Thank you, Kate. All of that, as you probably will note, makes me no more of an expert in vaccines than you all are, but welcome everybody tonight. We're glad you're able to join us. We hope that the information that you hear tonight will help you make a decision for yourself and for your loved ones about taking the vaccine. As you all read and hear, we've just passed 400,000 deaths in the United States from COVID-19. The virus has morphed. There are different strains of it. It's more easily communicable. And so the federal government and working with institutions and pharma companies throughout the world now have 1, 2, and almost 3 different vaccines that were going to become effective in battling this horrible, horrible disease. And so as you know, Governor Cuomo has said that people with developmental disabilities living in group homes, people in nursing homes, and the staffs are in group 1A. Other vulnerable people, including the elderly, and several other folks are in group 1B, which means that you will have priority to all the vaccines as they become available. We know there's a lot of fear out there. We know that, look, people are afraid of this disease and people are afraid of the vaccines, and you hear and read different things. And then there's the anti-vaxxer crowd and there's all of this stuff. So what we want to do tonight and throughout the rest of the month is give you good information and be able to answer as many questions as we can in order to have you make, and all of us make, the best decisions that we can. So we're very pleased that John and Rose and Sharon are with us tonight, and I'm going to turn it over to them to give you a little information and to start asking some of the questions that we already had, answering some of the questions that we've already had, and those which appear in the chat room. And we'll get to them, as many of them, because many of them are around the same topic. So let's see where we are. And Rose, John, and Sharon, thank you, and I'll let you start.
Okay, I'm online now. Rose, do you hear me? Everybody, are we good? So, perhaps I'll go ahead and start then. It's a very complex topic we're discussing here, and I'm doing these seminars and Zoom meetings around the city now quite a lot, and so a lot of these things keep coming up in similar contexts. So I think I can speak to many of the questions that folks have. It's funny. I've been giving flu shots with UCP going back 30 years now, right? And I always laugh because the consumer comes in with a worker, and I always offer the vaccine to the worker, and I can guarantee 99% of the time the person says no thanks. In fact, it's always a surprise when they say sure, I'll take it. Like, what? Let me get that on tape. In any case, it's something I've been aware of for many years now, that the folks that work in our agency and other agencies like ours, a lot of people, are young, they're healthy. They don't necessarily understand why would I need a flu shot? Why is that a good thing or a bad thing? So I think, in my personal experience, a lot of folks begin this whole topic with the understanding, well, really, I don't really want to take that shot. Thanks, but no thanks. So I think that's a very real fact, and that's partly why we're here. I would say, probably by way of disclosure, that I'm a very, very positive advocate about vaccines. So I will apologize if some of the things I say are just a little bit too positive, or a little bit it maybe not sounding balanced. So I do think that this is a good thing, but I think we can talk about it really scientifically. We can talk about it, from a number of vantage points that are honest, and I believe are very positive about this whole process that we're in now, as Ed just said, with the vaccine approach. And there's a lot of things going on right now that are going to make this, I think, certainly going to make the vaccines available to everybody, and we're going to now begin to hopefully, I think, turn this disease around. Now, a couple of thoughts before I go forward. Rose, did you want to say anything at the outset of this? Unmute.
Can you hear me now?
Yeah.
Okay. I just want to add, the purpose of tonight is not to convince anybody to take the vaccine. We want to give people the facts so that they can make an educated decision. There's so many rumors flying out there about things that are true, things aren't true. And I wanted to talk a little bit about the background into the development of this vaccine. The vaccine was developed in 4 phases or trials. These trials have started since last March, mid-March approximately. Each phase composed of different people. In phase 1, there were 20 to 100 people. They were healthy people. The purpose was to see if the vaccine was safe, what the side effects were, and if there was an immune response, was it working? In phase 2, they increased the amount of people. They went up to several hundreds of volunteers to find out if there was an immune response, the most common side effects, and how the body responded to the vaccine. Is the vaccine really working? In phase 3, which is one of the most crucial parts of the trials, is when they not only had healthy people, they had people with diabetes, hypertension, and that was a blind study that had some people receive the vaccine and some people not. So this was the real trial to see if the vaccine worked. They wanted to see the ratio of people to see if people received the vaccine, if they were exposed to the virus, if they were able to fight it off. So with much success, we moved on to phase 4. And that's where we are now, where we received approval for emergency use. So, people said it was approved too quickly, but they followed all the phases that any vaccine needs to go through. So I thought that was really important that we started with that. Sharon, I don't know if you want to say anything. Okay.
Okay, got him unmute.
Okay, maybe we'll move to.
Yeah, just go ahead. That's fine. Go ahead.
Okay,
Okay, so-
Sharon, go ahead. You want to say hi or?
Oh, hi. Yes, I'm Sharon, the nurse practitioner from the clinic, and that the side effects there aren't many severe side effects. It's pretty similar to other vaccines, such as joint aches, fatigue, and they go away within like 2 days. There haven't really been many severe reactions. I know they said Bell's palsy, but those people probably would have had Bell's palsy anyway. It wasn't related to the vaccine. I know that was something really going rampant, Bell's palsy.
Okay.
Yeah, as I understand it, gang, over 10 million people in the United States have now been vaccinated. And as you know, there are 2 vaccines, the Pfizer vaccine and the Moderna vaccine, both of which require 2, 3 or 4 weeks apart. But with over 10 million people hospitalized, other than a few aches and pains and having to stay home from work for a day, I have not heard of any. I think I've heard of 1 or 2 people that had to be hospitalized out of 10 million. So I think the odds are pretty good that most of the effects are pretty limited, and they can deal with the effects. You can take Tylenol, you can take other kinds of pain relieving things, as I heard. And anyway, over 10 million people now have had the vaccine. So it's been both vaccines have been pretty effective.
Well, let me go and jump in now and deal with what some of the things have been touched on here. So as Rose indicated, this vaccine was developed very quickly in March. I remember very vividly, as everybody here does probably, in March, the phone started ringing nonstop. And, I'd get a call, 5 people have a fever in this house and 5 people have a fever in that house. So, we have to keep in mind that this virus, right from the get-go, was very, very contagious. We talk about some newer variants that are showing up nowadays that are even more contagious. Now, I don't know if that really matters much. This virus, as far as I can tell, just hopped from everybody. I have some group homes where 20 out of 20 consumers have antibodies. So these are individuals that did very little other than touch doorknobs, maybe sneeze once in a while, but this bug went through everybody. So we talk about an organism, first of all, that's very contagious. And so, when we start to talk about the question of whether the vaccine is dangerous, the first question that you ask is, well, okay, so what are the odds that it's going to hurt me? We talked, as Ed just indicated, that maybe 10 or 20 million people now have received the vaccine. And of those people, I remember the report I read a few days ago, that's about 30 people around the country have showed one of these odd immune reactions where they either have, something like hives or, big red area around the side of the shot indicating an allergy. But in almost every case, those reactions were gone by the next day. So nobody was crippled, nobody was, anyway, just put out of commission by the vaccine. The vaccine was relatively benign. And that's only 1 out of a million. So when we say, 30 out of 30 million or 20 out of 20 million, that's very, very good odds. Now let's look at the other side of the coin. What's the likelihood that you're going to get the actual exposure to the virus? Well, as we just said, it's very high. This virus is just traveling through everybody's community. If you look at the statistics over the past 12 months, really, it's just bump after bump. The first wave, the second wave. Now we're all in the midst of a big third wave. So, without a vaccine around, there's only going to be a 4th wave and a 5th wave. If we think that in America, maybe 30 to 40 million people have contracted the virus, and that's, folks who, like in the early phases around here in New York, a lot of folks didn't get any kind of testing. So we know a lot of people got exposed and aren't in that initial group of statistics. But I'm imagining that most of the folks at this point in time who do have any kind of symptoms do go and get tested. So it's probably quite accurate now that something on the order of 200,000 Americans are being exposed to this vaccine every single day. So let's look at the odds of that. The chances that you're going to get exposed to the virus are very high. The chances that you're going to get really sick from the virus are very high. And the chances that you're going to get possibly a fatal reaction, some kind of very horrible blood clot problem are also high. And then that's on the order of like 2 out of 1,000. So let's compare the possibility of the risk of not taking the vaccine to you as something like 2 out of 1,000. And that's the worst case scenario. There's a much higher likelihood of having all kinds of problems that aren't only, a fatal outcome. What is the chance of having a problem from the vaccine? About 1 in a million. That's about the same as winning the lottery. I mean, let's be honest. If I handed you a filled out lottery ticket right now, I don't think anybody's heart's going to go pitter patter. I won. The chances of winning or chances of having an outcome that's really serious is very, very low. Yet the chance of having a serious outcome from the virus is really quite high by comparison. So first of all, that sets the stage for what the real dangers and risks are of this vaccine. Now, a second point I'll make is that the vaccine was done and developed very fast. There's nobody can argue that point. But I've done medical research over the years. When I want to enroll 5 or 6 volunteers, it might take a few weeks. If I need to get maybe 20 or 30 volunteers, it's going to take a few months. So how did they get 40,000 people? And that's not the folks that went through stage 1 and stage 2, but 40,000 people enrolled. And one thing that Rose mentioned is she did indicate that this study was blinded, but it's actually important to point out that it was actually double blinded. So that when the researchers grabbed a vaccine from the box and gave it to a person, they really didn't know if they had just given you a COVID vaccine or given you a sugar shot, so to speak. So it was double blinded. And then the real question that researchers had back in the summer, I remember reading these articles, it was felt at first before that period of July that maybe the vaccine was already fading. Our statistics were starting to show some good response. And the question was, will people actually get exposed to the virus during the 3 or 4 months that we need to find out if it helps? Well, of course, at about that point, a second wave did hit the country and a lot of folks got the virus. Now, this is the interesting thing about it. In the course of the 3 or 4 months after they opened up the data, they unblinded it. They found that there were about 900 documented cases of COVID exposure. COVID, actually 900 people out of those 40,000 got the bug, got the virus. Then they looked to see, well, who was who? And there's about 9 people in the vaccine part and about 891 in the sugar shot. It was unmistakable. I mean, it was like 95% protection. It was very dramatic. I mean, you almost never see something like that. And then, as Rose indicated, they did have people who were more vulnerable, and they did have people who were older and people who had coexisting conditions. And of those individuals, about 9 people got gravely ill during this study of 3 or 4 months, and only 1 of those people had gotten the COVID shot, and the 8 or 9 others had gotten the sugar shot. So not only were people getting really good antibody responses, but they were actually being prevented, even in the course of a few months, from becoming gravely ill. So I think the statistics and the science behind the vaccine are very clear. It's very effective. It's very safe. It's probably going to be lifelong in terms of immunity. We give Hep B vaccines all the time around here, and we take blood tests years later after the vaccine, and the antibodies are still there. So when vaccines are developed properly, they tend to make very good antibody responses like this one does. And those vaccines, particularly with a good booster, that's why we have to take 2 shots, as Ed just said, that booster allows the body's immune system to really kind of permanently, it's like a CD-ROM, it gets written in there finally. I mean, it's just going to be permanently etched into your body's immune system. And so you're going to have antibodies for a long time to come. Another question comes up, well, what about this new type of vaccine? Normally what we develop vaccines, they take a virus, for example, like the flu, and they find a way of inactivating it, hopefully, and yet not destroying it, so that once it's injected into you, the body does see it as though it were a live virus and make a good immunity to it, and at the same time, hopefully not get sick. Well, a lot of people get nervous about that when they talk to me about the flu shot, but this is a very different technology. The scientists here in this case were able to put a little tiny piece of genetic code, we call it mRNA, and they packaged it into these little tiny bubbles, these little tiny vesicles that are extremely fragile, and that's why it has to be frozen and so on. But once that enters into your muscle where it gets injected, your body sees that little piece of mRNA and it starts cranking out these little proteins that are normally associated with the living virus. those proteins start entering into your bloodstream and they're recognized as not you, they're foreign, and the body makes antibodies. So it's an extremely ingenious method. It's been on the books for a long time. The Moderna company that has probably the more stable vaccine that we know about was actually working on this for about 10 years after so-called SARS-1. You know, these are these early versions of the coronavirus that were appearing in the Middle East and as well as in the Far East in China. So the Moderna company had been developing this mRNA technology, not being able to license it because, of course, there was no real need for it at that moment, but they had explored it. So when we talk about something being done in 4 months, that's really not at all accurate. This technology has been around a long time, and it's been perfected now. And the company was able to jump on it and actually, you know, get a good product out there in a matter of 6 to 8 months. It's really a very great success story, I think. So we do have a vaccine that's been well developed, very well thought of. It's very sophisticated. At the same time, it does not involve anything living. There's no virus, there's no bacteria, there's no egg. You know, it's just a simple little piece of genetic code. It only produces the little protein called the spike protein. That's the thing that hits your nose and allows it to punch its way into the cell of your nose. So it's really exactly what you want to have antibodies against, because that's what your nose is going to be seeing and trying to fight. You know, people have asked a couple other points, and I'll end on this perhaps, but the question came up, for example, what happens if you get the first shot and then the next week you get exposed to the virus? Does that make your virus exposure worse? Does it maybe ruin the vaccine? So in point of fact, that's going to happen now. People are still getting exposed to the virus quite a bit, and we're hopefully going to begin in this country immunizing many millions of people. So there's going to be some bumping into itself. But in truth, I don't think there's any danger whatsoever about that. Either way, whether it comes in through the nose or whether it comes in through the shot in your arm, your body's going to begin to make immunity, and it's going to make it pretty quickly, hopefully with a second exposure, meaning a second vaccine. 3 to 4 weeks later, you're going to then make more of a permanent type of immunity. So I think we can safely say right now that there's not going to be any real interference, if you take the shot or if you don't take the shot vis-a-vis, protecting yourself. Well, I'm getting a little tongue-tied here. Yes, I mean, you're not going to have a problem if you do happen to get the shot and then get sick at the same time.
John and Rose and Sharon, there are a number of folks on the chat who are concerned about their underlying conditions, that not just their disability, but their underlying conditions. And they're wondering, are there specific underlying conditions that make the vaccine something that they shouldn't consider? Has there been any research or any data published or any information published about that?
Rose, you want to go ahead? Can't hear you.
You got to unmute, Rose.
There we go.
Can you hear me now?
Yeah.
Really, the only underlying condition they talk about is people on blood thinners, and then they ask you to reach out to your primary care physician to see if you're a candidate to have it or not. One of the questions come about is, I have underlying conditions. Am I strong enough to get the vaccine? I think the underlying conditions, are you strong enough not to get the vaccine?
Yeah.
Because I had it in March and I don't know if I could go through it again. So I think that underlying conditions weaken you if you get the actual virus, not if you get the vaccine. Dr. John, you want to add anything?
Well, it's so important to keep in mind always the danger of these preconditions insofar as how it's going to affect your viral exposure, if you get sick versus how they might affect your response to a vaccine. I think in most cases, the pre-existing conditions, are not going to play much role in how your body responds to a vaccine. It's often important to keep in mind the fact that we get exposed to bacteria and bugs and whatever comes our way day in and day out. I mean, our immune systems are built for this very purpose. So, people lead full lives, even if they have diabetes or even if they have heart disease. People make it into their 70s, 80s, 90s. You just learn to avoid certain things and, take certain choices. But the point is, you manage a full life. All the while, you're fighting viruses and colds and flus and all sorts of things. So, we're coming along with a little tiny piece of an organism and asking your body to make immunity to it. There's no bugs in there. There's no viruses. This is not a very big challenge to a person's system. So, the thing that really is going to hurt a person is getting the infection. And that's really, as Rose said, that's what you have to worry about with respect to pre-existing conditions. That's going to be very, very dangerous. I think the idea that you might be at risk for some kind of adverse outcome from a shot just because you have diabetes or heart disease or high blood pressure is just not sensible. I mean, our bodies are built to withstand these kinds of things. We live full lives, and getting a vaccine is not going to have any impact on that at all.
Some of the questions relate to which vaccine, and one of the things that people should know at our clinics and most of the community clinics around, or in most of the community centers or churches or people that have, will be the Moderna vaccine. And that's the reason is that it does not require the level of freezing that the Pfizer vaccine does. The Pfizer vaccine has to be frozen in very special freezers that go down to like 1 billion degrees centigrade minus, so that it's a very delicate, they're all very delicate. And the Moderna requires refrigeration and freezing as well, but in much more commonplace and commercially available freezers and refrigeration. So normally, if you're going to a community clinic, a church, or any one of the clinics out there that has vaccine, you're going to be getting the Moderna vaccine. By and large, it's only the large medical centers that are distributing the Pfizer vaccine, but both of them, as John and Sharon and Rosa pointed out, require 2 doses. The Johnson & Johnson one, which has not yet been formally approved by the federal government, will have, as best as I understand it, 1 dose. And but again, what's available right now, there are both vaccines require 2 doses.
Another thing to keep in mind is that while this discussion right now concerns the Moderna and Pfizer vaccines, the newer vaccines might require a second visit to this. We might want to, at that point, review some of these newer technologies will be different. And so some of the things we've talked about today regarding the mRNA type vaccines may not be exactly the same for the newer ones that are coming down the pike. So we may have to, examine that question if it comes up. But I think right now, the question before us is whether the current vaccines are safe, and I think they certainly are.
Excellent.
I think
Go ahead.
I just wanted to add, historically, any vaccine that has come out, people are so afraid of the long-term side effects. And historically, with any vaccine that has come out in the past, any side effects that came out during the first 2 months are the only ones that they really saw throughout the whole use of vaccine. So I thought that was important to mention.
And let me follow up on that, Rose, briefly. People talked about Bell's palsy. Again, Bell's palsy is the consequence of having had a viral infection. So, we're not giving a person in this shot a virus. We're giving them only the tiniest little piece of the hair of the virus, so to speak. These little proteins that find themselves on the cell surface or the outside of the virus. So, you can't really get those kinds of long-term side effects from this particular vaccine that we're talking about.
One of the things that people also want to know is if you've had the virus and therefore, have antibodies, should you still be, and you are eligible, should you still take the vaccine?
The CDC says yes. After you've had the actual virus, you have some antibodies, but they have not been tested. Generally, you can have antibodies up to 8 months. CDC says that you can be receive the vaccine 14 days after your initial exposure. So people have had the virus, have that antibodies, and still get the vaccination.
Just to follow up on that point, I think, one could argue, and I think it's probably honest to say, I probably don't need the vaccine necessarily. I can save it or perhaps give that dose to somebody else who might need it more. I think that's a sensible, perhaps, way to look at it. However, in my own case, personally, I thought it would be a good idea to take it. It's important for us all to sign on to this project and show some buy-in to that. But I think it's probably fair to say that an individual with good antibody levels, doesn't need it right away. They can maybe hold back a little bit, and they're going to be safe certainly for the time being. But in response to what Ed just said, the fact is, even if you've been exposed and have had, and I can talk about myself in that regard, I had the 2 shots by this point, and I had the full experience of the virus back in March. So, there was no side effect from that. I think all it does is basically act like a third booster, in that respect. The first shot being the first vaccine exposure being the original shot, so to speak, and then the further shots which we're giving the individual are like added boosters. So there's no real danger to that.
Another question that came up, will the vaccine implant a microchip that will be used to track the population?
Well, I mean, I can certainly speak to that. There's nothing in there in the way of a microchip. I mean, there's tiny little viral tiny little DNA or RNA particles inside these minuscule little vesicles. And, again, that's some of the stuff that's going to come up from time to time. A lot of folks will hear things on the internet, read things, and it's going to be a question, is that true or not true? To some extent, I think, this is where taking the vaccine myself came into play. I had a similar Zoom meeting today earlier when one of the gentlemen who was a worker in the agency, I could tell by the thick, West Indies accent, said, he took the shot. He wasn't clear about it, but, it was perfectly fine. And now everybody in his family says, okay, now I'm ready. I'm willing to do it. So, there's some reservation. I think people will tend to make up or at least hear things selectively to some extent. But, there's no microchip. There's no virus, no mind control. I think it's a pretty safe vaccine, truly.
Another question that has come up is when can consumers living at home get the vaccine?
Well, they're eligible now, Kate and everybody, because they're essentially in Group 1B, which is vulnerable populations and people over 65. So basically, for people with developmental disabilities living at home, they're in Group 1B, which now is a priority within the city. So if you can make an appointment to get a vaccine, please go ahead. You'll be given priority to do that. Right now in our clinic, which is still trying to get through the people living in our and in other people's residential programs along with the staff. So not that we're limiting it to that, but those are our priorities. But in the community-based health centers, churches, and everything else, the Group 1B people are eligible now. And by the way, if you want to get a microchip, anybody that has a cell phone, the GPS is available. They can track you anyway. You don't need the vaccine for that.
Thank you. And another question we had is, will the vaccine protect against the new strains of the coronavirus?
Well, let me address that. I think, to be truthful, we don't really know because we haven't tested that question. However, the virus, people have to keep in mind, viruses mutate constantly. Every organism on this planet. We take care of developmentally disabled people partly because that's a manifestation about how the genes change throughout time. And so viruses mutate very rapidly. However, if the virus mutates in a way that is not particularly good for its life cycle, it just disappears. So most of the mutations that occur in a virus, most of the time are basically just benign. They just occur in parts of the virus that don't show any effect. But once in a while, a mutation might in fact twist the protein in such a way that it punches its way into your cells a little bit better. Now, that being the case, that seems to be kind of what's happened. There's been a change in the virus, and we do now have a virus that's even more contagious than it was. But keep in mind, this virus is already off the charts in terms of contagion. So, to go from 1 million, to 1 million times 10, I don't know if that really matters much. But the more important real question is, does the change that's occurring to the proteins that punch their way into your tissues, are those really no longer going to be recognized by the antibodies? And the answer to that question, we do know. The antibodies do see those new viral versions as the same, so that the antibodies that are being produced by the vaccines will latch on to these more potent viral particles pretty much the same way that they will latch on to the ones that were going around the community in March and April, the rest of the year. So yes, I think we can safely say at this time that anybody receiving the vaccine that exists at this moment will be protected against variants that are circulating right now.
So a lot of the folks are questioning, and not questioning, or saying that they're trying to get an appointment but can't. So let me take that right now. The fact remains, if you see the news, read the paper, or anything else, there is a shortage. you know, I'm not going to get into the politics of it. Other people want to, but there is a shortage. And if you've heard Governor Cuomo talk about it, you know, he's trying to himself go to Pfizer and Moderna and purchase the vaccine in New York State. The fact remains is that there is a shortage here. So the community-based clinics, the Javits Center and others are doing the best they can. Remember, we have to make sure that once we give you the vaccine, we have enough for the second dose. So all I'll tell people is you're going to have to be a little patient. They are working on it. The government's working on it. The city's working on it. The state's working on it. And tomorrow, the federal government will be working on it. And so I think that I think you'll see an expedition. Soon to be President Biden has said he's going to invoke the Defense Production Act, which will give all of these companies incentive to drop other things and produce the virus. Produce the vaccine. Yeah, well, the virus produces itself. It's doing fine on its own. But I think that I think you'll see that. So just be patient. Keep calling around to the places that you have in your neighborhoods and other places to get an appointment. You'll get one. But remember, whether you have the vaccine, you don't have the vaccine, or afraid of the vaccine, or still wondering about the vaccine, or getting the vaccine, wear a mask and socially distance. There's nothing stopping that. Those are still the most effective things. Don't think that because you have the vaccine, you can't do those things. Trust me, those things are just as important with the vaccine as they are without it.
Another question that came up is, why do you have to take 2 shots at different times? And what happens if you miss the second shot? Do you have to I know that there's a certain time period they're asking, but what are next steps if you get the first shot and you miss the second?
Well, you know, I'll step in on that, Rose, real quick. You know, I mean, the shots, most vaccines always require a booster. That's been a truism in vaccine science for a long time. So, you know, the truth is that, you know, whether it's the MMR or the polio vaccine or the Hep B, so it's generally recognized by the immune system that if you challenge it more than one time, the body notices that and sees that basically the message is this bug is not gone yet. It's coming back. So your immune system recognizes that fact and boosts the immunity to a certain higher level. And then it really begins to create more of a permanent immunity. It creates certain parts of the immune system, we call them B cells, which then really become permanent residents of the bone marrow. And then they're going to be around for the rest of your life. So that second shot really is crucial. Yes, you'll get some protection from the first shot if you don't get that second one. That's not a bad thing. It won't hurt you that you did not get the second shot, but your level of immunity will be compromised. And for this one vaccine, for this one organism, you know, it won't be as guaranteed. One other little part of this is that, you know, we talk about getting that second shot in 3 weeks or 4 weeks. In most cases, vaccines are not that crucial if you get it in 6 weeks or 7 weeks. So in the event that you screw up or something happens and you miss your slot, you know, don't lose hope. Honestly, I mean, if it's 5 or 6 weeks, I think it's pretty safe to say that your immune system is gonna take care of that.
I just want to add, you know, that's some of the information coming out now where they're saying, oh, people are getting sick after the second injection. And the way the vaccine is divided, the first injection you receive 50% to 65% immunity. It's a building immunity. So when you get the second injection is when the immune response kicks in even further. So that's why you'll see more of people getting sick after the second, as opposed to getting so sick. You might get a headache and things with the first shot, but after the second shot, you might have a little bit more of a headache. You might have a low grade temp, but it's a building response. After you have the second injection, 2 to 4 weeks later, you're 95% immune. And I think that's a really powerful number. And what Dr. John said is true. You know, if you can't get it, say you do come down with COVID and you can't get the second injection at the 21 or 28, as close to that as possible. If you can get it, I get the second vaccine. Second dose.
I want to toss in that, you know, I did get the vaccine and I had the second vaccine, you know, a month or so afterwards. And it was interesting because the second shot, it was very clear it was more potent. That evening, I felt kind of feverish. I thought, gee, I must be coming down with something. And upon that, oh, I had a shot today. So, you know, it occurred to me, wow, the first test was nothing. The first vaccine was nothing. But the second one was a little more potent. But that's important to keep in mind as to why, because, again, we're trying to tell our bodies that, look, this virus is out there and it's coming for you. So you're giving people a vaccine. What happens when you give them the second vaccine, the body interprets that as, wow, this is serious. I got to deal with this. And, the immune response is more potent. And of course, you feel it. Now, when we say you have a fever, some people might conclude, see, they're lying to me. That has virus in it. You don't get a fever without a virus, but that's not correct. I mean, our immune system has all kinds of parts to it. There's the fever element. There's, of course, people's appetites change. People, of course, all sorts of things occur. All sorts of tiny molecules occur. We call them cytokines. All things happen. And really what you see with that more potent second shot is really the fact that your immune system is taking it more seriously and making really, like we call this, the lifelong form of immunity. So, I would actually view that personally as a good thing. Like, wow, this baby's kicking in, so I think that's a positive thing. Yes, it might mean you need to Motrin, you might need to sleep, take a day, but that's really a very positive thing, actually.
Another question we have is, do I have to get the COVID-19 shot every year, like the flu shot?
Well, that'll be the COVID-20 shot. We're going to have to change. No, it's actually a good question. What's going to happen? No one really knows. We haven't had a pandemic since, 1920. What happened after 1920? They came up with the flu shot. It took a while in those years to develop that technology. So, a lot of people think there will probably be an annual shot. Maybe it'll be a combination, I'm imagining. Maybe it'll be more than one thing inside that vaccine that you get. This might lead to now new types of flu shots that are more mRNA based, for example. So, a lot of things are going to happen. And that's a very important question because, there's going to be many meetings like this where people are going to say, well, what's the latest now? I haven't heard. The last report I saw was that scientists more or less assume that COVID will come to reside in the human community and there'll always be COVID cases. Most of the time, it'll be childhood type stuff. Kids get colds, gets all kinds of exposure. And so it'll probably be not much more than that. But, the truth is that these people who don't have immunity will catch it. You can't get around the fact that if your body is not immune, you're going to get this bug. It is going to get everybody. It's extremely contagious, and it's only becoming more contagious as time goes by. So I think it's going to be important to realize that, what we're talking about now is going to be on our minds probably for many years to come. And, I'm imagining that there will probably be eventually a pretty large mutation in this COVID bug, and it will require a whole new vaccine. But most likely, what's going on right now, the so-called COVID-19 is going to be a permanent immunity. And, I think at this point, we'll have to wait and see.
And what's in the vaccine?
Rose, you want to explain that?
I defer to you, Dr. John.
Okay, I mean, I don't want to hog the screen, but let me just say that, it's always, to the average person, probably a total mystery. Someone grabs a needle and jams it in your arm, like, what's that? But, here we can be very clear. These are these tiny little snippets of genetic code. Everybody's heard the word DNA. That's part of how we're built. But RNA is the part of the genetic code that makes proteins. So every time you make muscle, every time you make mucus, anything in your body that is a protein, it had to start with a piece of RNA. And the RNA came from the DNA, so it's just a copy. But there's a whole part of our body's cells that's like a machine. It just pumps out a protein as soon as an RNA approaches it. And so, our bodies are doing this nonstop, day in and day out. They just don't necessarily recognize the fact that that little piece of code that you put in the shot is actually the code for a virus protein. And, the body just makes protein. So it just proceeds to do so. So to answer the question exactly, what's in the vaccine is a tiny little snippet of RNA. And that RNA does what all RNAs do, it makes a protein. But in this case, the protein is the little tiny hairy thing on the outside of a COVID bug. It's called the spike protein. So anybody who's seen a cartoon of Corona, it's always this little kind of circular jobby with these things sticking out. And those little things sticking out are the spikes. And that's what your body starts to make. You say, wait a minute, my body's making a virus protein? Okay, well, yeah, it's what exactly is happening. But your body doesn't use that spike protein. Instead, it just looks like it's coming from someplace else.
Dr. John, isn't that what happens with the flu shot as well?
Well, it's the same outcome, which is that your body makes antibodies. But
Right.
You, in this case, give the flu virus particle. So it's been cooked, it's been irradiated, so it's dead as can be. But the outside of it basically its spike protein is intact. So by giving the flu shot, you're allowing the dead bug to circulate around in your bloodstream, and the outside of the flu shot has its own kind of spike. You know, it uses that spike for another purpose, similar to enter your body. But so your body makes immunity to the outside of the flu particle. But in fact, you know, rather than give people coronavirus particles, which is, you know, no one's going to accept that as an approach right now. They thought, let's just give the spike protein only. And they figured out the best way to do that is give the RNA that produces it. And, you know, as Rose said, you know, when these studies were started back in March, nobody really knew if this was going to work. I mean, as I indicated, the Moderna people had been looking into it, and they felt pretty strongly that it would work because they'd been testing it in chimps and, you know, other animal, you know, models. And they knew that it probably was going to work. They really didn't know. So it was a bit of a gamble. And, you know, there aren't any other major vaccines right now based on RNA technology. So that was another big gamble. So yeah, I think personally, from my point of view, we're very fortunate. I mean, the vaccine worked. It worked big time. I mean, as our dear president said, it worked bigly. I mean, this was a very, very good vaccine. It seems to be extremely protective. People are not dying when they were given the sugar shot. I mean, there are 9 people that got gravely ill in that vaccine study. So had those individuals gotten the real thing, they wouldn't have gotten sick. That's why these studies have to be terminated as quickly as it's clear they're working, because we can't afford to give people sugar shots in those types of settings. So yes, it's not quite the same as the flu shot, but it's really the same outcome. That is to make an antibody.
Sharon, you know, I have read, and I think some people have read too, that, you know, people, men and women of color, men and women of different ethnic origins and backgrounds are fearful that their response to it would be different than, you know, frankly, white America or white anything. And so have you seen or heard any of that? And what's your response to some of that as with the people you've seen and yourself you work with?
Well, yeah, yes, they are. Some of them are skeptical about taking the vaccine. They feel like it was made too soon, or they feel as if, you know, it should have taken longer. But my mom, for one, she was not eager to take the vaccine initially, but now she's like, you know, well, we got to get that vaccine, because I explained to her that it's not a live virus, like what Dr. John said, that it's really just a protein, it's messenger RNA from the virus. It doesn't even pass the cell wall, that it's just getting our immune response to pick up and take flight and react. It's the risks, the benefits, the risks far outweigh the benefits. I mean, but yeah, that's what I'm saying. So you can't afford to not be vaccinated at this point because you're putting yourself in jeopardy. But yeah, they are. They're pretty skeptical. Some people are still skeptical about getting the vaccine. I just have to educate and let them know that that's not the right choice at this time. You need to seek the vaccine. So I guess it just takes education and letting them know that it's not dangerous. You know, there have not been any serious side effects from it. So they're better off getting it than not getting it.
Yeah, one of the questions that we're hearing here is that, you know, why are we only doing the Moderna vaccine and not the Pfizer? Well, I think, you know, from our standpoint, the amount of refrigeration and frankly freezer capacity that you'd have to have for the Pfizer, but is as far exceeds our own capacity, and the Moderna is something that we can handle. But from your guys' perspective, do you think, or have you read or heard that there's any difference in the effectiveness between the Pfizer and the Moderna vaccine?
Well, I think there is no difference whatsoever. You know, they are both equally effective. It's almost identical as technology. I think the only reason the Moderna vaccine, as I indicated, was more stable is because those scientists had been working on this problem for a while. So they actually have the almost identical approach. You know, this is a little snippet of mRNA, as we said, and it's embedded in a little tiny particle that gets, you know, injected. So these are almost exactly the same. It's just there's a little bit of something that the Moderna people learned to add to it to keep it a little more stable for a couple more hours and make it a little more useful in that way. So I think the answer is no, there's no difference whatsoever.
And another question that came up, is it safe for people supported who are allergic to foods and medicines or penicillin, or people who are on EpiPens to take the vaccine?
Well, I'll talk to that. I think the answer is yes. We know in our business, and I have one person in mind that we serve that, you look at her, she breaks out in a hive. So there are always going to be a few individuals who have just this terrible history of allergies. And, individuals like that, you have to be kind of cautious. And I think, we might want to take some special care. But even then, those individuals are not, we're not talking about anything with any food particles. There's nothing related to eggs or almonds or shrimp. So people who have allergies to all sorts of things are not going to encounter any of those things in this shot. But really what we're saying is that, gee, they seem to react to everything. Maybe we better be more careful. I think what we've done, practically speaking, is say, look at, we take about 10 to 15 minutes per person to watch and wait. But, for people like that, let's watch a half hour. Let's just give their chance, their body a chance to express that possibility if it's going to happen. But as I think Rose was saying earlier, things that happen with allergic responses or adverse responses tend to happen right away. So a person, who's going to have a reaction is going to be known to everybody. We're going to obviously deal with it in all the different clinics around the world and around our country that are going to be doing this kind of work, but it's going to be very few and far between. Again, look at the numbers. 20 odd million people have been given this. Now, you can take those 20 million people, and I'm going to bet you there's tens of thousands who swear they're so allergic to this, so allergic to that, but in point of fact, nothing happened. I mean, it's not like I'm saying nothing will happen or nothing might happen. I'm saying nothing happened. So these are people who, like us, who, react to this or react to that. So these are very large populations of people who are taking this shot. And the fact is, nobody's responding like that. So, again, nothing of nuts, nothing of seafood, nothing of food content. None of those things are parts of this shot. There's no eggs. These vaccines weren't raised in eggs. So anybody that says, well, I knew it. A gentleman came to me just the other day and said, right from the get-go, I'm not taking a shot. I know I can't. I said, what do you mean? He said, well, I can't handle eggs. And I remember at that moment that he and I had that discussion for 10 or 15 years about why you don't get the flu shot. So I said, whoa, wait a minute. No. You can get the shot, and instantly he was thankful because he was assured in his mind that he couldn't afford to do that. And I reminded him, no, there's no eggs here. So it's interesting. Some of these questions come up because we're just so accustomed to saying, no, I can't do that. No, I can't do this. It's too unsafe. But I think right now we're seeing that's just not the case. Now, yes, am I going to say nobody's going to have a problem with allergies? No, we haven't said that. We said it's very unlikely. And as I think I heard Sharon say, I mean, the odds or the risk of not taking the vaccine is really what you want to think about, particularly if you have those kinds of conditions. It's very dangerous not to do it. But I think the allergy question is going to prove to be relatively mild at this point.
Great. And so I just want to be mindful. It looks like we're winding down on our time together today. So I just wanted to give the panelists an opportunity to make any last statements before we wrap up.
Rose, you can step in if you like. Oh, can't hear you.
Sorry. I think in review of the data that we discussed today, we can say that the vaccine is safe. No corners were cut to put this vaccine in place. They followed all the necessary guidelines for a vaccine to come into play. And I think that the risks outweigh, the benefits outweigh the risks, that it's important to get the vaccine, in my opinion.
Right.
Sharon?
Right. I agree. I have to admit, in my history, I haven't really been that much of a fan of vaccines, but as time is, I had seen an experience, and as a young nurse, where a resident got the flu vaccine and he had Epstein-Barr and he passed away the next day, and I was very fearful of it from then. But as time went on, a few times of having the flu, I said, no, I need to just get this vaccine. And I mean, and this is even worse, this COVID-19, I've seen it, it puts fear into anyone that ends up actually coming down with it. I think it's just safe. Thank goodness they have found this technology And I think it's safe and it's the best bet just to go forward and get the vaccine, because once you get it, there's a lot of remaining problems that they found once you get this COVID-19, that it doesn't, you could end up with lifelong problems just from getting COVID-19. And why not just get the vaccine and even have a few side effects and then know that you're safe and you don't have to worry about the rest of it.
Yeah, these long haulers, as they're called, have months and months and months of almost unrelated type of symptoms where they just can't ever start to feel back to their old selves. So this is really, this thing has, lots and lots of long-term problems that you'll read about years from now, that, how it affected people beyond their initial symptoms.
Right. It's not worth it.
I want to thank Sharon and Rose and Dr. Michnovicz for their time tonight. This is being recorded, and I'll have so that we can continue to show it both on our YouTube channel and other places. And we will be glad to do this again as time rolls on here, because we want to be sure that more people get as much information as possible to make the best decision for themselves, for their families, and for their loved ones. And so, Laura and Kate, I'll turn this back to you to end up, and thank you all very, very much.
Thank you again for participating in today's webinar, and special thank you again to our panelists. And we want to apologize if we didn't get to the chance to answer anyone's question. So in the event that happened, you can email us at info@adaptcommunitynetwork.org, and we'll be sure to respond accordingly to your questions. Thank you all, and have a great night.
Good night, all.
Good night.